people ask me that all the time. How is it? And I say, well, what aspect do you want to know? Do you want to know the emotional aspect? I can tell you stories where, unfortunately, family members have to say goodbye to their loved ones with an iPhone. If you stay in the room, it's very emotional to have somebody, somebody's mother, grandparent, say goodbye to their loved ones and know that they're not going to talk to them, for a while. And unfortunately, in the first wave, it was forever sometimes.
I know as a physician, you're accustomed to that life and death scenario, but in this case, you're handing over your phone to make what is likely that last phone call. What is that like for you?
It is very hard on us emotionally. There's not much we can do for these patients. There's some patients that come in, you can treat them quickly, they're going to get better. COVID patients, you just don't know. But the glimmer of hope right now is the vaccine. Personally, I'm scheduled for this Thursday, in a couple days. So I'm very, very excited about that. I feel like I will have a better mental state when I walk into a room.
And who is that demographic that you've been dealing with?
So I see people mainly that have no place else to go, in the inner city, who are really getting hit hard. I've seen full families, 5 of 6 people who lived in one household die. It's just tragic. I think, I was going to see like one of the family members. I recognized the name and I asked one of my colleagues, could you go see them for me? I think when they look at me, they realize that, I might be the angel of death here because I saw, their family members in the past and, they ended up dying. So unfortunately, that person did die too, but one of them survived. It's unfortunate.
People like you can't afford to get sick, doctors and nurses and everyone who supports that staff. So, what is your message for people here as we make that decision to stay home and stay safe?
I know that if you stay away from people and you isolate, you're not going to get it. That becomes impractical, right? Then you can't work. If you don't work, don't have a job, don't have money, that's going to have negative impacts on your health. Also, if you don't socialize, that's going to have negative impacts on your health. I think the best approach maybe is to, try to isolate with your bubble. Okay. Try to work from home if you could work from home. If you do go out, always mask up, always wash up, always be cautious. I know it's difficult for us in the hospital. I'd like to say that we're almost full. We're full. All the hospitals I work in or call or they're full. And it's a matter of a major game of somebody getting out of the ICU, somebody in the ER maybe moving up there, and then somebody else moving around. And we're using everything we can where we take any place that there could be a bed, we're making it into a bed. We're really, really bending, we're really bursting at the seams. It is difficult for us. You can think about us. You can say, hey, I want to protect healthcare providers. It's not a bad idea, but I don't want to guilt anyone into it.
Dr. Frank LoVecchio, an emergency room physician, thank you.
Thank you.